Hello, Medicos. Good day to all of you. This is Dr. BK for you, and today I am going to discuss about the infratemporal region. So, in the infratemporal region, mainly I will be talking about the muscles of mastication in this lecture. So, the learning objectives for today's lecture will be mainly a short introduction about the infratemporal region or infratemporal fossa. Followed by that, we are going to understand and appreciate the boundaries of infratemporal fossa, the various bony walls of the infratemporal fossa. Followed by that, we will list out the contents of the infratemporal fossa. Then we will discuss about the muscles of mastication. So under the muscles of mastication, each muscle we will be actually trying to learn about the origin, its insertion, nerve supply, action, relations, and finally we will actually also discuss the applied anatomy of these muscles. So now first coming to the infratemporal fossa. Now the name itself suggests infratemporal means it is actually below the temporal bone. So that is why it is actually called as the infratemporal fossa. And where actually it is situated? It is situated on either side, lateral to the pharynx. So lateral to the pharynx on either side of the pharynx, and the external limit will be your ramus of mandible. So from the ramus of mandible superficially to the lateral wall of the pharynx is the infratemporal fossa. So there is no particular shape for this fossa as such, whether it cannot be described as a quadrilateral or triangular, pyramidal, any such shape, because it is a very irregular space. It is just a space which is filled with mainly two muscles, and mainly you come across the mandibular division of the trigeminal nerve and the maxillary artery. Okay, so this infratemporal fossa, as I told you, is between the lateral wall of pharynx and the ramus of mandible, where actually it is situated below the middle cranial fossa. So you know the interior of the cranium, the floor of the cranium has got three fossas: anterior, middle, and posterior cranial fossa. So the features of the cranial fossa we have actually discussed extensively on the osteology of the skull part 2. So middle cranial fossa mainly extends from the uh, lesser wing of sphenoid, posterior sharp border of the lesser wing of sphenoid, anterior, that is the anterior limit, and the posterior limit will be the upper surface or the superior border of the mainly your petrous part of temporal bone. Okay, so the superior or upper border of the petrous part of the temporal bone, where you have the attached border of the tentorium cerebelli. Okay, so this space is mainly occupied by two muscles, the pterygoid muscles, the medial pterygoid and the lateral pterygoid muscles. They occupy the infratemporal region, and as I told you, the trunk of mandibular nerve with its branches, the commencement of the branches from the mandibular nerve is also seen in this infratemporal region. And maxillary artery also you come across. Then one more ganglion is also present. So mainly it is filled with the muscles, that is your lateral pterygoid muscle, and deep to it you see the medial pterygoid muscle. And then what you see here is the trunk of the mandibular nerve, which is emerging from the foramen ovale. It is actually dividing into anterior and posterior divisions, and then it is giving out various branches. So this forms the major content of the infratemporal region or infratemporal fossa. Now, let us try to understand the boundaries of infratemporal fossa. So, this space, which is below the middle cranial fossa, is bounded anteriorly by the posterior surface of body of maxilla. And this bulged part is also called as the tuberosity of the maxilla. Okay, so posterior surface of the body of the maxilla, and above you can see the infraorbital fissure passing, and then you can see the other end of the infraorbital fissure is the infraorbital foramen. So that is seen on the upper surface of the body of the maxilla. Posteriorly, you have the styloid process. Okay, so this is your tympanic plate of temporal bone, which has got the external acoustic meatus. That is your styloid process. Temporal bone has got a styloid process, and one more process behind is the mastoid process. So styloid process with the carotid sheath medial to the process forms the posterior limit of the infratemporal fossa. Okay, then laterally the rambus of mandible. So that actually forms the lateral boundary of the infratemporal fossa. Okay, so only if you remove the rambus of mandible, you will be able to see the pterygoid muscles which are present deep to the rambus of mandible. Okay, and then followed by it with the coronoid process of the mandible. You can see that one of the process of the mandible is the coronoid. The anterior process is actually called as the coronoid process. Okay, so anteriorly, posteriorly, and laterally, these are the body landmarks. Okay, which forms the various boundaries of the infratemporal fossa. So medially, you have the lateral pterygoid plate. Okay, so the pterygoid bone has got a lateral pterygoid plate, and then you have the medial pterygoid plate, and that hook-like process is actually called as the pterygoid hamulus. So this is actually the pterygoid hamulus. This is your maxilla, this is your lateral pterygoid plate, and between that two you see a very small triangular shaped bone that is called as the pyramidal process of palatine bone. And this narrow gap between the pterygoid and the maxilla is called as the pterygomaxillary fissure, which leads into a fossa which is called as the pterygopalatine fossa. So medially you have the lateral pterygoid plate. Superiorly or above, the roof is mainly formed by the infratemporal surface of greater wing of sphenoid. Okay, the infratemporal surface of the greater wing of sphenoid, and to some extent the squamous part of temporal bone. In the roof, mainly you come across two foramens. One is the foramen ovale and other one is the foramen spinosum. Okay, below it is actually open and it communicates with the parapharyngeal space, or the space which is present on either side of the pharynx is called as the parapharyngeal space, because as I told you, medial limit, or you can consider the lateral wall of the pharynx as also the floor of the infratemporal fossa. So infratemporal surface of greater wing of sphenoid, which you are able to see here, and you come across the foramen ovale, and then behind that you see the foramen spinosum, and behind that you see the spine of sphenoid. This is your temporal bone, mainly squamous part, which has got articular fossa, and then that is the articular tubercle. Through the articular fossa, the head of the mandible, or what you call it as the condyloid process of the mandible, articulates, forming the temporomandibular joint. That is the inferior border of the zygomatic arch you are seeing. The zygomatic arch is mainly formed by the temporal process of zygomatic bone and zygomatic process of temporal bone. So both the bones actually contribute for the formation of the zygomatic arch. This is temporal process of zygomatic bone. This is zygomatic process of the temporal bone. Okay. So now coming to the communications of this infratemporal fossa. Before that, I will again quickly just repeat the boundaries. Anteriorly by the posterior surface of body of the maxilla. Then posteriorly you have the styloid process with the carotid sheath. Medially you have the lateral pterygoid plate. Laterally what you have is the ramus of mandible. Below it is open and it is continuous with a parapharyngeal space. Above it is mainly formed by the infratemporal surface of greater wing of sphenoid and the squamous part of the temporal bone. Now, the main communications of this fossa, it communicates with the orbit through the infraorbital fissure. With orbit, it communicates through the infraorbital fissure, which is actually seen on the upper surface of the body of the maxilla. Through the infraorbital fissure, it communicates to the orbit. Then it also communicates with the pterygopalatine fossa via the pterygomaxillary fissure. Pterygopalatine fossa, mainly the pterygomaxillary fissure. Okay. So through this, mainly the maxillary artery will enter. Then it is called as the third part of the maxillary artery, which gives rise to so many branches. Pterygopalatine fossa. So inside the pterygopalatine fossa, you have the maxillary nerve, trunk of the maxillary nerve, and it is giving various branches. Then you have the pterygopalatine ganglion, and certain sympathetic nerves. Okay. So you also have deep petrosal nerve, which is actually a sympathetic nerve joining with the greater petrosal nerve also is there. So pterygopalatine fossa is a separate topic which we will deal in the forthcoming classes. The next communication is, it actually communicates with the above temporal fossa. So that communication occurs deep to the zygomatic arch. So deep to zygomatic arch, the infratemporal fossa communicates with the temporal fossa, that is above and laterally. Above and medially, it communicates with the middle cranial fossa. That is through two foramens in the roof, which we have already seen in the last slide. That is the foramen ovale and the foramen spinosum. Through this, the infratemporal fossa communicates with the middle cranial fossa through foramen ovale and foramen spinosum. Then, as I told you, it communicates with the temporal fossa deep to the zygomatic arch. Actually, the zygomatic arch has been removed for us to appreciate the infratemporal region. So, what are the contents of the infratemporal fossa or infratemporal region? Mainly two muscles. Now, this view is, you are viewing the infratemporal region from the medial aspect or from the inner aspect. So, if you look it from external aspect, that is the other side of the mandible. Now we are looking from the inner aspect. So mandible is actually lateral. Okay. So deep to the mandible, when you look, mainly you are able to see the medial pterygoid muscle and the lateral pterygoid muscle. So two muscles mainly form the major content of the infratemporal fossa. Okay. Then apart from that, you have the trunk of the mandibular nerve, which is emerging from the trigeminal ganglion, that is ophthalmic. Then this is the maxillary, which is passing through the foramen rotundum, and that is the trunk of the mandibular nerve emerging from the foramen ovale. Okay. So the trunk of the mandibular nerve and its branches, giving so many branches. I am not discussing about the mandibular nerve in this class, and that will be my next lecture. Then you have the insertion of temporalis alone. So the tendon of temporalis getting inserted into the coronoid process of mandible. And as I told you, mandibular nerve and its branches. Then one more nerve you are able to see, which is coming via the middle ear. This is your tympanic membrane, is the cauda tympani nerve. So that comes and joins with one of the branch of the mandibular nerve, that is the lingual nerve. So you have mandibular nerve and its branches. Then you have the cauda tympanic nerve, which is actually from the facial nerve. Okay, that is actually from the facial nerve. This is going to carry parasympathetic fibers to the submandibular ganglion and also taste fibers to the anterior two-third of your tongue. Then you see one of the peripheral parasympathetic ganglion, the otic ganglion and its roots in the infratemporal fossa. So this otic ganglion is actually a peripheral parasympathetic ganglion which gives postganglionic fibers to the parotid salivary gland. Okay, so that is one of the parasympathetic ganglion which you come across in the infratemporal fossa. Of the four ganglions in the head and neck, parasympathetic ganglion, this is the second one which we are coming across in the infratemporal region. First ciliary ganglion which we have discussed in the orbit class. Then maxillary artery, mainly the second part you are able to see, the second part of the maxillary artery you come across in the infratemporal region. Okay, so these are the major contents: medial and lateral pterygoid muscles, two muscles, insertion of temporalis alone, mandibular nerve and its branches, cauda tympanic nerve which joins at an acute angle with the lingual nerve, otic ganglion and its roots, and then the second part of the maxillary artery which you come across. Then you also have a plexus of veins which is called as the pterygoid plexus of veins. Okay, now coming to the muscles of mastication. So there are actually four muscles of mastication: Masseter, temporalis, medial pterygoid and lateral pterygoid. So you have four masticatory muscles: Masseter, temporalis, lateral pterygoid and then the medial pterygoid. Now these muscles are mainly responsible for moving your mandible. They bring about the lower jaw movements. These lower jaw movements by actually acting on the temporomandibular joint. So the movement takes place at the temporomandibular joint, that is the joint between the skull and the mandible. And you all are very much aware that the mandible is the only movable bone in the skull. Okay, so these four muscles mainly act on the temporomandibular joint and bring about various movements of your lower jaw. This is very much necessary for mastication or munching, so for biting and munching the food, so making the food into a bolus, so that is very much necessary, and also for speech. So we have to move our jaw for a speech, not only our lips and the tongue. So for the articulation of speech, tongue is essential. Same way lips actually what happens are essential, and third one is even the jaw movements are very much necessary. Without actually moving our jaw, it is not possible to actually speak. So as I told you, they act on the temporomandibular joint and bring about the various movements of the mandible. And these muscles are all developed from the first pharyngeal arch or the first branchial arch. So there are actually first, second, third, fourth and sixth, five arches. Fifth arch disappears. So from the first arch, from the mesoderm of the first arch, you get these muscles. So mainly the muscles are these four muscles of mastication. So along with that, you also have anterior belly of digastric and mylohyoid muscle. Then you have tensor veli palatini muscle and tensor tympani. So how do you understand these are actually developed from the first pharyngeal arches? Because they all will be supplied by the mandibular division of trigeminal nerve. So the mandibular division of trigeminal nerve is the nerve of the first arch. So even though the muscles they migrate to a different place, they take along with them their nerve supply. So that is how we can confirm they are actually from a single source of development. So with a short introduction on these muscles of mastication, now I will pass on to the first muscle, which is actually masseter. So a short quadrilateral muscle, but a very strong muscle. Okay, it is a very thick quadrilateral muscle. The density of muscle fibers are abundant, and actually it is present or consists of three sets of fibers. Okay, and it is present in a more superficial plane at a transition zone between your face and the parotid region. Okay, so one of the muscle which you can see superficially is the masseter, and when you clench your teeth, definitely you can feel your masseter. That thick or stuff bulge which you see over your mandible when you just clench your teeth, what you are feeling is the masseter muscle. And we all have mentioned masseter while describing about the facial artery. The facial artery enters the face by actually through the anterior-inferior angle of the masseter. It has got four angles, 1, 2, 3, and 4 angles at the four corners. Okay, and the masseter muscle is actually covered by a thick fascia, masseteric fascia, and that is continuous with the fascia of the parotid gland. So that is why it is called as the perotido-masseteric fascia. Okay, it is a very thick fascia, and there is also a space between them which is called as the masseteric space, which is a part of masticatory space. So I'm just introducing certain things so that you will actually have a note of it in one corner of your mind, and when we discuss with the appropriate topics, then you should be able to recollect these things. So as I told you, it is made up of three sets of fibers: superficial, intermediate, and the deep set of fibers. To put it simply, you can tell the origin is from the zygomatic arch. But to be more precise, superficial fibers arise mainly from the zygomatic process of maxilla and also from the lower border of the anterior two-thirds of the zygomatic arch. That is the origin of superficial fibers. Middle fibers or intermediate fibers also arise from the lower border and the medial surface. Whereas the deep fibers, they actually arise from the whole of the medial surface of the zygomatic arch. Now these fibers, they pass downwards, backwards, and laterally at an angle of around 45 degrees, and they get inserted into the whole of the ramus of mandible. That is on the lateral surface of the ramus of mandible, the masseter muscle gets inserted. So that is the area of insertion. So on the lateral surface of the ramus of mandible. So the superficial fibers in the lower part, middle fibers at the middle of the ramus, and the deep fibers in the upper part, and also encroach a bit onto the coronoid process of the mandible. From below to above, you can see the superficial, intermediate, and the deep fibers of the masseter. So it is mainly supplied by masseteric branch of the mandibular nerve from the anterior division. The masseteric branch. Okay, so it emerges via the mandibular notch and then supplies the muscle from the deep surface. Okay, and this masseteric nerve also gives a branch to the temporomandibular joint, an articular branch to the temporomandibular joint. So mainly supplied by the masseteric nerve, which is seen intimately related to the mandibular notch, and then supplies it from the deep surface. So it is a strong elevator of mandible. So pulls the mandible upwards. So that means it helps in closing your jaw. Okay. So most of the muscles, of the four muscles, the three muscles are mainly bring about the elevation of the mandible. So the elevation or closing of mouth is an anti-gravity action. Against the gravity, actually it has to take place. So that is why these muscles require more power, and not only that, the place of their insertions create rough markings over the bone. Okay, because they very much what happens, firmly anchor to the bones where they get inserted. So apart from elevating, the superficial fibers, they protract the mandible, and the deep fibers assist in retracting the mandible. That is, one is pulling the mandible forwards, its protraction, and then one is pulling the mandible behind is actually called as the retraction. So coming to the second muscle, which is the temporalis muscle. The name itself temporalis because it arises from the temporal region, especially from the temporal fossa. So above the zygomatic arch, what you see is the temporal fossa. So it arises from the squamous part of temporal bone, temporalis muscle, and you look the fibers actually they spread or radiate, and that is why it is called as the fan-shaped muscle. So it mainly arises from the temporal fossa, squamous part of temporal bone, up to the inferior temporal line. Okay, up to the inferior temporal line. You have two lines, inferior and above that you have superior temporal. Superior temporal line, as you pass posteriorly, it fades away. Whereas inferior temporal line is actually continuous with the supramastoid crust above the external acoustic meatus, above and superior to the external acoustic meatus. So the limit of the temporal fossa is only up to the inferior temporal line. Okay, and then what happens is this temporalis muscle is covered by a fascia which is called as the temporal fascia. From the temporal fascia also these muscle fibers they arise. So all the fibers, what happens, they converge and pass deep to the zygomatic arch. Converge and pass deep to the zygomatic arch as a tendon and get inserted into the coronoid process. So mainly it is getting inserted into the tip and anterior border and medial surface of the coronoid process of the mandible, the sharp process in front. This process behind is a condyloid process or head of the mandible. And between the coronoid process and the condyloid process, you have the mandibular notch. Okay, so that is about the temporalis muscle insertion. Now, what is the main action of the temporalis muscle? Before that, the nerve supply is by deep temporal nerves. Two nerves are there, deep temporal nerves. They are again branches of the anterior division of the mandibular nerve, and again they supply from the deep aspect. So the nerve is actually present between the muscle and the bone, the temporal fossa. So thereby it supplies from the deep aspect. Deep temporal nerve supplies the muscle from the deeper aspect. So action, the posterior fibers are mainly helpful in retracting the mandible. Posterior fibers retract the mandible. That is very important action. And mainly what happens is they are concerned more with the power than the speed of contraction. Okay. So and the anterior fibers they assist in elevation of mandible or elevates the mandible, closes the jaw, whereas the posterior fibers pulls the jaw backwards. Okay, so the action mainly of the mandible, protraction or retraction, then elevation, depression, all what happens is responsible for the chewing movements. And you know very well these muscles should have both power as well as the speed of contraction, because you know very well how many times we move this mandible during our single meal. So at least 3 times a day during our breakfast, lunch and dinner, and in between also what happens is we use this muscle, and even for speech during all speech we use this muscle, so it should not easily get fatigued. That is one thing. And second thing, what happens is that power and range is necessary. Force of contraction is also very very important, because when you want to munch a very hard structure, when you want to bite and hard structure and all those things. So the temporal this muscle is covered by a fascia which is called as the temporal fascia. You are able to see here. Above it is attached to the inferior temporal line, and below what happens? It splits into two and gets attached to the two lips of the zygomatic arch, upper border of the zygomatic arch, to the external and internal lip of the zygomatic arch. So you are able to see it divides into two lips, two layers, superficial and deep layer. Between these two layers, you can see the superficial temporal vessels and the zygomatico-temporal nerve, which is passing between these two layers. So as I told you below, it splits to attach to outer and inner lips of the zygomatic arch. So its deeper surface gives attachment to the temporalis. Now this fascia morphologically is a bone which can be seen in tortoise as a single bone, and it is also converted into a canal. Okay, so morphologically it represents a bone which you can see in the tortoise. Now this upper border, the superficial layer of the temporal fascia, they merge with the epicranial aponeurosis. They merge with the epicranial aponeurosis, and not only that, after merging, this also gives rise to your auricularis anterior, posterior, and superior muscle. So three muscles are there which move the external ear or the pinna, but these muscles have become vestigial in humans. Next, coming to the very important muscle of the masticatory group is the lateral pterygoid muscle. So the lateral pterygoid muscle is also considered as the key muscle of the infratemporal region. Okay, it is considered as the key muscle of the infratemporal region for many reasons. One reason is it divides the structures in the infratemporal fossa into superficial and deep. Only deep to the lateral pterygoid you have the mandibular nerve and the mainly your medial pterygoid muscle and the otic ganglion. So division of structures into superficial and deep. That is one reason, key muscle. Second reason is it is surrounded by a plexus of veins which is called as the suboccipital plexus of veins. So that aspect I will again discuss in the clinical anatomy or the applied anatomy in the concluding part of this lecture. Then one more reason is this muscle is the only depressor of the mandible. While all the three muscles actually elevate the mandible, Masseter especially assisted by the temporalis and the medial pterygoid. This muscle is the depressor of the mandible, the only depressor of the mandible of the masticatory muscles. It arises by two heads. One is the superior head and other one is the inferior head. The superior head mainly arises from the infratemporal surface and crest of greater wing of sphenoid. So for the roof, infratemporal fossa, infratemporal surface and crest of greater wing of sphenoid, it arises. The lower head arises from the lateral surface of the lateral pterygoid plate. So the lower head mainly arises from the lateral surface of lateral pterygoid plate. Both the heads unite and form a tendon which gets inserted into a fovea or depression on the neck of the mandible. Okay, this is the condyloid process, and below this is actually a small constriction called as the neck. On the neck you see a depression, fovea. Okay, so in that it gets inserted. Not only that, it also gets inserted into the capsule of the TM joint and also to the intra-articular disc of the TM joint. Okay, so the intra-articular disc itself is considered as a degenerated tendon of the lateral pterygoid muscle. So next, coming to the action and nerve supply, it is mainly supplied by nerve to lateral pterygoid. Okay, the nerve to lateral pterygoid is from the anterior division of mandibular nerve. So most of the branches of anterior division of mandibular nerve are muscular branches. Okay, muscles of mastication, they supply temporal nerve, masseteric nerve, nerve to lateral pterygoid. These three mainly. Okay. So the action mainly is depressing the mandible. So depression of mandible is brought about by when the muscle actually what happens is pulls, then naturally what happens, the condyloid process is drawn forward. When the condyloid process is drawn forward, the jaw opens, and mostly gravity itself aids in opening the mandible. So gravity also aids in the depression of the mandible. And there are other muscles also which I will actually discuss in the accessory muscles of the mastication, accessory masticatory muscles. So next, since it is a key muscle, contraction apart from depression, if lateral pterygoid and medial pterygoid muscle of both sides they act together, it brings about protraction of the mandible. Whereas lateral pterygoid of one side and medial pterygoid of other side they bring about side to side movement. Okay, side to side movement is brought about by alternate contraction of lateral pterygoid of one side with the medial pterygoid of opposite side and vice versa. Okay, so that is about the mainly the lateral pterygoid muscle. Alternate contraction brings about side to side movement. Now coming to the relations, so here you are able to see the lateral pterygoid muscle. Above the lateral pterygoid muscle, what you see is the ramus of mandible, and what is attached to the external surface of ramus of mandible is your Masseter muscle, and also the insertion of the temporalis muscle to the coronoid process. These three forms the superficial relations. Masseter muscle, ramus of mandible, and the temporalis muscle attaching to the coronoid process. Deep relations. So this is your lateral pterygoid muscle inserting into the fovea or neck of the mandible. So deep to this, we are actually viewing from the inner aspect of the lateral pterygoid. So mainly you come across the mandibular nerve with its branches, deep relations. Okay. So mandibular nerve, the trunk of the mandibular nerve with the branches, all you are able to see here. Inferior alveolar nerve, then you are able to see the lingual nerve, then you are able to see the auriculotemporal nerve, and then the nerve to the medial pterygoid. So all those branches you can see. Then cauda tympanic nerve, also branch of the facial nerve coming and joining the lingual nerve. So that also you are able to see. It actually comes through a fissure called as the petrotympanic fissure. Okay, so now it is beyond the scope of this class to discuss more about this cauda tympanic. Just remember, in the infratemporal fossa, it actually joins with the lingual nerve. The middle medial artery, branch of the maxillary artery, for the first part of maxillary artery, you can see the middle medial artery, one of the main arteries supplying the meninges. So it enters the foramen spinosum along with the nervus spinosum, which is the meningeal branch of the mandibular nerve. Deep relations we are discussing. So mainly mandibular nerve, cauda tympanic nerve, middle meningeal artery. Then you are able to see mainly the second part of the maxillary artery. Okay, second part of the maxillary artery you are able to see here. Actually, the lateral pterygoid muscle divides the artery into three parts. First part prior to the muscle, second part on top of the muscle, third part actually after passing between the two heads of the lateral pterygoid, it continues as the third part. Mainly in the infratemporal fossa you come across the second part. The branches of second part are mostly muscular. First part gives rise to 5 branches. Okay, deep auricular, anterior tympanic, middle meningeal, and accessory middle meningeal. So these are the branches of the first part of the maxillary artery. So you come across the second part of maxillary artery, then sphenomandibular ligament. From spino-sphenoid, it attaches to the lingula of the mandible. It is a remnant of the Meckel's cartilage or the first pharyngeal arch. Then the deep to the lateral pterygoid, you see the deep head of the medial pterygoid muscle. Upper border of the muscle is related to deep temporal nerves and deep temporal arteries. Deep temporal nerves and deep temporal arteries. Lower border is related to lingual nerve, inferior alveolar nerve, sphenomandibular ligament. Okay, then also the middle meningeal artery, which passes deep but first seen in the lower border. Middle meningeal artery, sphenomandibular ligament, lingual and inferior alveolar nerve, all seen along the lower border. Even the inferior alveolar vessel also seen along the lower border. Then between the two heads, you see the maxillary artery passing to be continuous as the third part, and the buccal branch or the buccal nerve which is emerging between the two heads. The buccal nerve is actually a sensory nerve which supplies the skin over the cheek region, buccinator. This is the sensory branch from the anterior division of the mandibular nerve. Okay. So buccal nerve and maxillary artery between the two heads. Upper border, deep temporal vessels and nerves. Lower border, you see the lingual, inferior, alveolar, middle meningeal, sphenomandibular ligament. So the last muscle in the muscles of mastication is your medial pterygoid muscle. So it is a quadrilateral muscle. Again, it arises by two heads, superficial head and a deep head. Superficial head mainly arises from the medial surface of the deep head arises from the medial surface of the lateral pterygoid plate. So that is the deep head you are able to see, which arises from the medial surface of lateral pterygoid plate. Lateral surface of lateral pterygoid plate gives origin to your lateral pterygoid muscle, lower head. So tuberosity of the maxilla, and also from a small pyramidal process of palatine bone, which I showed you in the beginning, the bony infratemporal fossa, while we discussed about the bony walls. So there I have showed you from the tuberosity of maxilla and from the pyramidal process of palatine bone, the superficial head arises. So both the heads, they unite and they pass backwards and are inserted into the medial surface of the angle of mandible, posterior to the mylohyoid groove and mandibular foramen. So it is attached to the medial surface of the angle of mandible. So here you are able to see the inner aspect of the medial pterygoid muscle. So the medial pterygoid muscle is actually passing backwards and downwards and getting inserted into the medial surface. This is the lateral surface of angle of mandible. This is the medial surface of the angle of mandible. Okay, and deep to that, what do you call the medial pterygoid muscle? You see there is a tensor palatine muscle which passes around the pterygoid hamulus and just getting inserted into the hard palate. So tensor veli palatine muscle is actually seen more medial to it. And this is your posterior nasal apertures or the cone. So posterior to it, this area is your pharynx. So what opens into the upper part of your nasopharynx is your auditory tubes. So that is why I told you the infratemporal fossa extends are limited laterally by the ramus of mandible and medially by the lateral wall of the pharynx. So that is why below the fossa is continuous with the parapharyngeal space. So nerve supply to the medial pterygoid is mainly by the nerve to medial pterygoid, which is from the directly from the trunk of mandibular nerve. So this also carries preganglionic parasympathetic fibers to the otic ganglia, the nerve to medial pterygoid. So mainly it is elevation of mandible. Apart from that, the same action what I told you with respect to the lateral pterygoid. So simultaneous contraction with the lateral pterygoid, these two bring about the protraction. Alternative contraction of lateral pterygoid with medial pterygoid as opposite side brings about the side to side movement of the mandible. Okay. So now coming to the relations of the medial pterygoid. So first to deal with the medial or the deep relations, as I told you, so that is a lateral pterygoid plate. Deep to the lateral pterygoid plate, mainly you are able to see the tensor veli palatine muscle and the lateral wall of pharynx. Superior constrictor, you are able to see here on the lateral wall of pharynx, which forms the floor of the infratemporal region. Then lateral relations. So above the medial pterygoid. Okay. So what are all the lateral relations? You come across the lateral pterygoid muscle. So above the medial pterygoid, you see the lateral pterygoid muscle and then sphenomandibular ligament, inferior alveolar vessels and nerves, and your lingual nerve and maxillary artery. So all these mainly forms the superficial or lateral relations of the medial pterygoid. So lateral pterygoid muscle itself is superficial to it. Naturally, what are all is present superficial to the lateral pterygoid, like your maxillary artery. Then sphenomandibular ligament, inferior alveolar vessels and nerves, and lingual nerve mainly forms the lateral relation of the medial pterygoid muscle. Now coming to the accessory muscles, why do we call accessory muscles? They also assist in mastication. The four muscles which we have discussed mainly act on this TM joint, temporomandibular joint, in various movements of the mandible. One more muscle, buccinator muscle, should definitely be considered under the muscles of mastication because it helps to push the food into your oral cavity. So whatever the food is accumulated in the vestibule of the mouth, so through the contraction of this muscle, it is pushed into the oral cavity. Otherwise, what happens is, if this muscle is paralyzed, then it leads to accumulation of food in the vestibular cave of the mouth. Then other muscles or accessory muscles are your digastric muscles, anterior and posterior belly of the digastric, and the mylohyoid muscles. So they also assist in depressing the mandible. So for these muscles to act, the mylohyoid or the anterior and posterior belly, they are all suprahyoid muscles which is attached to the hyoid bone. So hyoid does not form any joint and it is just held in its place by the position of the muscles. So this has to be first fixed or stabilized by the infrahyoid muscles. The infrahyoid, when they actually contract, what happens is the hyoid bone is actually held firmly so that the suprahyoid muscles can act. So that is how what happens, they bring about the depression of the mandible, mainly your mylohyoid, digastric and the geniohyoid muscles. So infrahyoid muscles, they fix, and naturally this bring about or assist in depression along with the lateral pterygoid. Finally, coming to the clinical aspects of today's session, Masseter might undergo spasm of Masseter or trismus or locked jaw. So Masseter of both sides might undergo spasm, mainly in tetanus infection. Okay, so that is one thing. The jaw can also get locked in TM joint dislocation. So if you open your mouth, temporomandibular joint too much, especially while yawning, what happens is the head of the mandible might get dislocated and move below and to anterior to the articular tubercle. And even then, what happens is your masseter might undergo spasm and you won't be able to elevate the mandible or close your mouth. So again, there also locked jaw occurs. Then mandibular nerve injury. So this might be due to trauma or sometimes when you use mask ventilators. In that case, what happens is mandibular nerve injury might take place. But in this case, motor deficiency is very rare. Only sensory, what happens is the sensations are altered, especially over the parotid region. You can see temperature or touch sensations are not appreciated. Okay, then by administration of non-steroidal anti-inflammatory drugs, through treatment, what happens is that can be gained. Then finally, pterygoid plexus of veins. This we are discussing here because of the lateral pterygoid muscle. This plexus of veins is actually surrounds the lateral pterygoid muscle. And this plexus mainly communicates with the cavernous sinus through inferior ophthalmic vein and through emissary veins passing through foramen ovale or visualis. So through emissary vein and also through infraorbital veins, what happens? It communicates with the cavernous sinus. Now, when the oxygen concentration of the blood inside the cranial cavity decreases, okay, so lot of CO2 concentrated blood is circulating inside the cranial cavity, then what happens is we feel drowsy. So that is why we yawn. So when we yawn, what happens is we open our mouth. So the opening of the mouth is by the contraction of the lateral pterygoid muscle. So when the lateral pterygoid contracts, the plexus around this also what happens is squeezed. So blood from here is immediately rushed through these veins into the cavernous sinus. So already stagnant blood which is present in the cavernous sinus is pushed from here into the internal jugular vein. So thereby most of the venous blood which is actually circulating inside the cranial cavity is drained through the internal jugular vein. Now fresh blood, that is oxygen rich blood, can enter via the internal carotid artery. So this is one thing which the lateral pterygoid muscle does. So that is why lateral pterygoid is also considered as the peripheral heart. One more peripheral heart is the soleus muscle which we have discussed in the lower limb. So that is all for today, and the next class I will be discussing about the other structures in the infratemporal region, mainly your mandibular nerve and otic ganglion. Okay.